Does cervical spine manipulation fix carpal tunnel? Zarrin wants to find out with this prospective study where they use just conventional therapy versus conventional therapy plus neck manipulation in 60 people. What did they find out? They're published, they have a p-value. Of course, it favors the manipulation group. What does that tell us? Carpal tunnel syndrome is not deficiency of neck manipulation, but there's a reason why the nerve is getting entrapped. Our modern approach to healthcare is to look at the site and try to treat the site because that's where we believe the problem is. But actually, the carpal tunnel is only one of the areas where a nerve can get trapped. And many times what we find is a double crush. So the nerve will be tethered at multiple entrapment areas. Now, one such area can be up in the neck, because if the neck is not sitting properly on the spinal column, the nerve roots that will eventually form the brachial plexus that form the median nerve can get trapped there. And if they get traction there, it can manifest in the hand as a carpal tunnel syndrome. So the rationale is actually pretty good. If you fix the neck issue, the pressure here would come down, the nerve being tractioned over here should come down, and things should improve. We're back to the same question again. Is carpal tunnel deficiency of cervical neck manipulation? And the answer is no. Why? Because one, there's obesity, there's gender, there's postural conditions that are not just in the neck, but they can also be in the scapula, they can be in the way the arm sits, the way a person's using their body, how they're using their body, ergonomic factors, the kind of work they're doing, the way they're doing it. All those different things also factor in. Now, did they account for that? They don't have mention of that. So, are they wrong? Not really. And maybe they happen by chance to get the right amount of people who actually do improve with cervical manipulation. Maybe that's not exactly cleared out here. But nonetheless, we know carpal tunnel has a lot of associated etiological factors. If we don't address all of them, we're not really doing our job properly. But yes, if you have a person with carpal tunnel who's having this kind of problem, cervical manipulation by a therapist could help. You still have to fix all the other stuff.